Today we're going to treat the under eyes, also known as the tear trough. It makes a huge difference to rejuvenate the face. It's very safe and it actually does not hurt. So the tear trough is this area. It's this area. And you can actually see it better with the patient's eyes open, and if you really want to accentuate it, you have them gaze upward, and then you can see it even more. Okay, you can relax. So this is an area there where you need very little product. The only fillers that I use in this area are hyaluronic acid fillers, like Restylane and Volbella and Velour. You don't want to use any of the other types of fillers there, as they have a higher risk of causing bumps. Okay, so we'll get started. I'm just going to wipe off the area with a hypoallergenic wipe. She's had some numbing gel on the area for about 10 to 15 minutes. This area numbs really quickly because it's such thin skin. So today we're doing Volbella under the eye. It is made of hyaluronic acid, so it's very safe for all areas of the face. We're using the smallest needle available, so a 30 gauge needle. And we'll get started. All right, so are you okay keeping your eyes open, or do you want to close them?
Keep them open.
Okay. All right, so what I do is I'm going to pull the skin taut, and then we sort of make a little jiggle to the skin because it distracts the skin so that the first poke is not as uncomfortable. 1, 2, 3. Good. I use my other hand to feel where the filler is going in so that I know exactly where the tip of the needle is at all times. Especially in this area, the key is going very, very slow and steady. I'm only putting tiny little bits of product. It's a very slow process. So far I've put 0.1 cc's. I try to look while I'm doing it instead of taking the needle out so that I can avoid having to poke the skin multiple times. And I back out of the skin as carefully as I go in to try and limit the disruption of the tissue and the blood vessels. Then I take my handy Q-tip to massage the area. This just allows the product to disperse evenly. The product is mixed with a little bit of lidocaine, so it does numb the area. How are you doing? Good. Okay, great. All right, do you want to take a look and do that?
Oh, sure, yeah.
Okay. All right, so we're all done. She did great. Not even a drop of blood. So she's going to take a look at the camera so everybody out there can see what we did. Basically, we treated right under here. And it's going to just refresh the under eye and make her look more well rested. All right, so now we're going to do the other side. We've looked in the mirror and confirmed that this is the area that we're going to treat. It's just very, very early volume loss under the eye. So we've already cleaned it off. We'll get started. All right, we're gonna get started. So I use my other finger to just confirm the location. Right before I do, I stretch the skin to look for veins that I want to avoid. And then we do that shaking technique. 1, 2, 3. I also changed the needle. So this is a fresh needle, so less painful, less risk of bruising. And again, just very slow and steady. Look all the way up really high. I just want to see if that spot, I can barely see it. Okay, you can look normal. Okay, good. Back out very carefully. So what I'm doing is I'm just holding direct pressure with a Q-tip for the little spot that was bleeding. You hold direct pressure for 1 to 5 minutes without peeking, and you can pretty much stop any bleeding. And as long as you catch it early, you can really prevent a bruise. So I'm using my other Q-tip to just smooth out the area under the eye. As far as taking care of it, I generally recommend patients to ice this area on and off for the next few hours. Then they can take a break. And then this evening, I would have her ice one more time. I also would have her sleep propped on about 2 pillows and ideally sleep on her back if she can. I recommend avoiding strenuous exercise today and tomorrow. You also want to avoid medications and supplements that can worsen bruising, such as baby aspirin, fish oil supplements, Advil, ibuprofen, and Aleve. You could take Tylenol if you needed to. Obviously, if you're taking any of those for a medical condition, you should continue taking them. So let's see how that is doing. Perfect. The other thing that we do sometimes is we apply arnica patches nearby. Arnica is an herbal homeopathic extract that can limit the duration of a bruise. All right, so you can take a look.
Oh yeah.
I think it looks really good.
Yeah, I love it.